Hi, I'm Dr. Ron Briglia. In this video, we're going to talk about flossing, or the technique of flossing. We won't go in depth on gum disease and periodontal disease. That's covered online and in a lot of our blogs on our website. The reason flossing is so important is that if you brush and floss one good time a day and have no bleeding after you floss, that's more effective long term than brushing 20 times a day and never flossing. The reason it's so important to floss is that when you brush your teeth, you're only getting 70-80% of the bacteria, plaque, and food out between your teeth. That other 20-30%, over time, if it's not flossed out, will cause chronic inflammation, and the toxins will start to dissolve the bone or eat the bone away between your teeth. And the sad thing is, it all happens without you even having any pain or feeling it. Healthy gums don't bleed. So if you start to floss and you see, your gums are bleeding or there's blood on the floss, your gums are not as healthy as they could be. In a few minutes, we're going to demo flossing to show you exactly how it should be done. What I like to do is have our patients take out about this much. It might seem like a lot, but here's the reason why. What you do is you take the floss, both ends, at the end of the floss, and it doubles the floss. So if you're going to be flossing, doubling the floss increases the cleaning area 100%. So if you're right-handed, you take the floss in your right hand, and around the middle notch of your left hand, what you do is you wind your floss clockwise you don't want it too tight to turn your finger purple. But this is your storehouse for right-handers, and it would just be opposite for left hand. So you're wrapping most of the floss around that middle finger. Then on your right hand, the same spot, middle finger on the left, you go counterclockwise about 3 or 4 times until the floss is around, it's not flopping around, both ends are contained. When you floss, the reason you wrap the floss around your middle fingers is that when you get into the proper position, it's your longest fingers on your hand to get back far. So here's what you do. With your index fingers, you grab the floss, and then your 2 middle fingers, you make a tightrope. Similar to that. Again, the floss about 12 inches or so. With your index fingers, you grab the floss, then your 2 middle fingers make a tightrope. Now with the tightrope, what you do is put the floss, get it through your contact area, and wrap it around like a C shape when you're flossing around the tooth. Then there's a little gum tissue. You pop it over the gum tissue to clean it adjacent to the head of it. Okay, and here's how to floss the back teeth. Taking the floss as we demonstrated, index fingers grabs the floss, 2 middle fingers make the tightrope, and now I'm going to be able to get it all the way back to the last tooth in the mouth, upper and lower. And that's the technique of flossing. It helps to start in one area first, say the upper left, work your way around to the right, then drop down from the right all the way to the left. It takes time to get the dexterity. I recommend do your first flossing using a mirror, and you'll get to the point where you'll be able to floss watching TV. As I mentioned before, it's done once every 24 hours, and it doesn't have to be late at night. It could be done anytime during the day. There are some products that work pretty well. I'm sure everyone has seen these products. The only problem with these is it's one strand, and a lot of times when you're trying to get it in there, it doesn't wrap around the tooth like you can do with your two hands. And a lot of times it gets stuck and breaks, and it's much easier to go through to floss with a regular floss. However, for our patients who just find it really too hard to floss or don't have the dexterity, there's another product called brush picks. And what these are, they're similar to toothpicks. You can see there's like a little tuft of plastic, And what it's done. Instead of flossing, this is how these are used. And there you have it. If you're able to have the discipline to get to the point where you're flossing once a day or even once every other day and have no bleeding when you floss, you really reduce your chance of gum disease. You'll keep your teeth healthier, you'll have fresher breath and easier cleanings. Thank you for watching. I hope these tips were helpful.